Welcome to today's webinar, Understanding and Managing Pain. My name is Sarah Tirani, and I'm the Program Coordinator for Triage Cancer, and I will be moderating today's webinar. Now, before we dive into today's topic, I just need to go over some housekeeping. All callers will be muted for the duration of the webinar. If you have any questions or technical problems, please type them in the chat box to the side of the screen. This webinar is being recorded and will be available for viewing by the end of the week on our website, triagecancer.org. After today's session, you will receive an email with a link to an evaluation. We would appreciate it if you would take a few moments to provide us with your feedback. We are very grateful for the support of Novartis Pharmaceuticals and the Alliance for Fertility Preservation for sponsoring the 2018 Triage Cancer webinar series. As part of the accreditation process for healthcare professionals, we have to read the following disclaimers and disclosures for you. This presentation is intended to provide general information on the topics presented. It is provided with the understanding that the author is not engaged in rendering any legal, medical, or professional services. Although this content was reviewed by professionals, it should not be used as a substitute for professional services. The planners and presenters for this program have not disclosed any pertinent financial relationships or conflicts of interest. While this education program has received commercial support from the previously listed sponsors, the content of this program has no relation to the commercial interests of the organization's products or services. I'm pleased to let you know that Triage Cancer is an accredited provider of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. Therefore, nurses participating in the live webinar may be eligible for 1 hour of contact credit. In order to receive contact hours, you must have registered online for today's session. People who are listening in on someone else's computer are not eligible for credit. You also must attend the entire webinar. No partial credit will be awarded. Anyone watching a recording of this webinar will also not be eligible for credit. Within 1 week of this webinar, complete an evaluation and post-test. You must receive a passing grade on the post-test to be eligible for contact hours. You will receive an email following this webinar, which will contain a link to the evaluation and post-test. Please note that on the evaluation, it asks for your name and email address. You must include these so that we can certify that you completed the evaluation. That email is the address we will use to mail certificates. We will be sending out certificates within 4 to 6 weeks. Again, we are only offering contact hours to nurses at this point. If you have any questions or experience any problems, email us at info@triagecancer.org. For those of you who aren't aware, Triage Cancer is a national nonprofit organization that provides education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. We provide this education in a few different ways. First, we host a Speakers Bureau of experts in all types of cancer survivorship issues available to organizations putting on an educational event. You can read our speaker bios and request a speaker on our website. We also participate in events all over the country. Some of these events are hosted by our partners in the cancer community, and some are events we host ourselves. To see where we're going to be, take a look at our events calendar. Every year, we host 3 Triage Cancer conferences. This day-long event, covers a variety of cancer survivorship topics. We welcome patients, survivors, caregivers, advocates, and healthcare professionals at this free event. This year's upcoming events will be held in Reno, Nevada, and Lewiston, Maine. Travel assistance is available for patients and survivors to attend these events. As you know, we host a monthly webinar series open to anyone in the cancer community. The next one will be on September 12th and it's entitled Medicare: An In-Depth Look. Recordings of past webinars are also available on our website. We will be providing CEUs to nurses and social workers for the September event. We also host 2 educational programs that are specific to healthcare providers. The first one is an in-service event for healthcare professionals called Navigating Cancer, Work and Insurance. This program is delivered in partnership with Cancer and Careers. The second training for healthcare professionals is the Insurance and Finance Intensive. This is a comprehensive certificate program for oncology healthcare professionals and advocates on health and disability insurance and finances. You can get more information and register for any one of these programs on our website under the Events tab. In addition to our events, we offer a number of educational materials and resources online. Our quick guides are designed to be a snapshot of a particular topic. They cover areas such as health insurance, employment, clinical trials, financial topics, estate planning, and legal assistance. We also have checklists and other documents designed to help with the legal and practical pieces of cancer survivorship. All of these documents can be downloaded for free on our website, or you may order hard copies of these materials on our website at triagecancer.org/material requests. Because we recognize everyone learns in different ways, we also provide educational animated videos on cancer survivorship topics. We have this one on health insurance basics with key information that you need to know about your health insurance plan, especially to minimize your out-of-pocket costs. These videos are now available in English and Spanish versions, and the English video also has Tagalog subtitles. We also have compiled some of the most frequently used state-specific resources on our site. And because where you live can impact what protections you have access to, we have charts of state laws on employment, disability, health insurance, and other cancer-related issues. Cancerfinances.org is a site that we host in partnership with the SAM Fund that provides practical information on topics that can impact your finances. This website is designed to guide users to the information that is most relevant to their situation. We currently have modules on health insurance, disability insurance, education rights, and financial assistance resources. More topics will be added soon. And finally, our education blog not only provides great information about cancer survivorship topics, but because things are constantly changing in the cancer community, this is how we share late-breaking news. And our monthly newsletter is where we announce all of our upcoming events. Now, with no further ado, I'm delighted to introduce today's speaker, Yvette Colón. Dr. Yvette Colón is the Associate Professor at Eastern Michigan University School of Social Work and a founding board member of the PAIN community. She is also part of a multicultural group practice providing culturally sensitive psychotherapy to individuals, couples, and families, and supporting clients with a variety of issues, including chronic pain. For over 25 years, she has provided bilingual social work services in a variety of nonprofit health and mental health settings. Currently, she serves as an editorial board member of the Journal of Pain and Palliative Care Pharmacotherapy and the Journal of Social Work in End of Life and Palliative Care. She has published and lectured extensively on psychosocial oncology, pain management, end of life care, diversity, LGBTQ affirmative practice, and technology-based social work services. Dr. Colón is a distinguished member of the Triage Cancer Speakers Bureau and has been a longtime supporter of ours. We are so thankful for Dr. Colón to be joining us today. Dr. Colón, welcome.
Thank you very much, Sarah, and thank you to all the Triage Cancer crew. You know, I've known you all for a long time, and I'm always very, very happy to be working with you. So thank you so much for the lovely introduction. And I will also add that I am a longtime oncology social worker who kind of found her way to the chronic pain world. And so I live in both worlds these days in terms of my work, my research, and presentations such as this. So, you know, I don't really know what all of your level of understanding is, so I just want to go over some basic information about the definitions of pain, how pain is generally assessed, what options you have to treat pain. Most people think that medication is the primary way to be able to treat different kinds of cancer-related pain, and I want to sort of get you thinking about other options, and also to think about effective ways to communicate about your pain with your healthcare team. And I want to finish up with just a handful of good resources for cancer pain management that will kind of be a springboard, hopefully, for your involvement in helping manage your cancer pain, or helping, if you are a healthcare professional, managing, helping manage somebody else's team. So what is pain? What is the actual definition of pain? Well, in 1979, the International Association for the Study of Pain defined, sort of medically defined pain, a definition that we still use today: an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. Very important definition, also very expansive definition, because it talks about potential tissue damage, sort of describing it with the idea that sometimes pain happens and you can't actually, most of the time you can't actually see it. There may not be specific tissue damage, for example. So I think very forward-thinking medical definition of pain. But this is the definition that I want you all to remember. Pain is whatever the experiencing person says it is, existing whenever the person says it does. And this definition of pain was created by pain management nurse Margot McCaffrey in 1968, 11 years before the IASP created their medical definition of pain. What Margot McCaffrey was really trying to highlight was the subjective nature of pain, that it is what the person who experiences pain says it is. Pain, sort of the science of pain, the medicine of pain, is fairly complicated. And so this is the only science part that I'm going to be talking about. But I think it's important to think about the pain circuit. The pain circuit refers to signals that travel through the central nervous system, through the spinal cord, right, through small nerve fibers. The ends of all of our nerves are talking to each other, transmitting information, conducting those pain signals to the brain. The experience of pain, the perception of pain, pain itself, is called nociception. Nociceptors are sensory receptors whose signals through the nervous system are interpreted by the brain as pain. It is not a one-way process. It is a very interactive process, which is what I'll be talking about a little later. But it's not just the neurological, our neurological understanding of pain. Dame Cicely Saunders, the founder of the modern hospice movement, coined the term total pain to characterize the multidimensional nature of the person's pain experience, to include not just physical domains, but psychological, social, and spiritual domains. Those are really, really important. The concept of total pain in the assessment and management of cancer pain says that optimal pain is not possible. Optimal pain relief, optimal pain treatment is not possible if all the dimensions of total pain were not addressed. Pain occurs in very complicated and complex contexts. It doesn't just affect people physically, doesn't affect just their activity, their sleep, their energy, their physical intimacy, but also psychological context, social context, and spiritual or philosophical context. We need to have a psychosocial perspective, as Dame Cicely Saunders talked about, total pain. Biological understanding of pain means that we recognize that pain is a signal that your body has been harmed in some way, and that we need to pay attention to that signal. But in chronic pain, the amount of pain that's felt is usually not very much connected with the extent of the injury or the illness. So instead of only originating from bodily harm, pain can manifest without tissue damage. The neurons in the central nervous system become excited more easily, so you feel pain for longer periods of time, and you feel pain much more easily. How you perceive and express pain is influenced by your beliefs, your mood, and your prior experiences. How you experience pain is influenced by how you perceive it. Unrelieved pain is also often associated with sleep disturbances, depression, anxiety, functional impairment, and disability, right? I have always believed that we can't consider pain without also considering how the person is able to or not able to function in the context of experiencing pain. We also have a social understanding of pain. Pain, we know, has detrimental effects on family, on loved ones, on other social relationships. The behavior of people experiencing chronic pain happens in social contexts, right? We don't live in isolation. Pain happens in social contexts where social influences have a role in magnifying or diminishing feelings of suffering and disability. Again, a reciprocal relationship to each other. And spiritual understanding of pain is also important, or philosophical understanding for people who don't necessarily have an identified faith or don't consider themselves spiritual. I often talk about philosophical viewpoints, right? Chronic pain can make you feel isolated and helpless. It can challenge your spiritual, your religious, or philosophical belief systems. And as a result, spiritual, philosophical, or existential needs can be overlooked, not just by you, not just by your family, but sometimes by healthcare professionals who are working with you to try to help you relieve your pain as much as possible. So when we talk about pain, we think about several dimensions that are important to consider. The sensory dimension, the location and intensity of the pain. How much does it hurt? Where does it hurt? Are there multiple locations of pain? Can you identify where the pain is, where you are feeling the pain? What is called the affective dimension of pain, the emotional component. What pain does to us. Does it make us feel more helpless? Does it make us feel anxious or depressed or sort of psychologically isolated? The cognitive dimension of pain is the meaning that we assign to that pain, and that all of these things have cultural components. There are cultures in which pain is seen as something redemptive, or pain is seen as something that is necessary to grow as a human being. All of those beliefs, those cognitive beliefs, the meanings that people assign are things that we need to pay attention to. They are legitimate ways that people try to understand their experiences. And behavioral dimensions of pain. Sometimes people are not able to verbalize their pain. Either they don't have the words to describe what they're feeling, or they have cognitive deficits that prevent them from being able to verbalize their pain. So we focus on verbal and nonverbal behaviors, grimacing or crying, for example, rocking or positioning, feeling agitated or restless, clenched jaw, tense body language, things that give us clues that the person may be experiencing some kind of pain, but is not able to talk about it, describe it, or communicate about it. And pain is not just pain. There are different kinds of pain that we might want to consider. Acute pain usually lasts a short time, 3 months or less. It's often a sign, it's almost always a sign that the body has been injured in some way. This pain, acute pain, generally goes away as the injury heals. So somebody might have pain related to chemotherapy that goes away after 2 or 3 months. They might have procedural pain, right? They go to the doctor for their infusion and the needles hurt, right? That pain usually goes away as the injury heals. So it is much different than chronic pain, longer term pain, and it generally resolves in fairly standard ways. A healthcare provider, doctor or a nurse, may be able to tell you, anticipate, you will be feeling pain for this period of time. This is what will happen as it resolves it. And by a certain period of time, in a month or 2 or 3, you shouldn't have this kind of pain. It's kind of a way to be able to standardize experiences that last a short period of time in order to be able to communicate around it. Chronic pain, also called persistent pain, is a little bit more complicated. That lasts for longer periods of time, more than 3 months. And it can range, all pain can range from mild to severe. And we know that chronic pain, chronic cancer pain, can disrupt your life if it's not treated adequately. It may not go away, the pain may not go away, or it may not be reduced sufficiently, but it could be managed pretty well by following a good treatment plan. And if pain were not complicated enough already, there is also something called breakthrough pain, which is a flare of pain that happens. The pain breaks through. Even if you are receiving treatments regularly for chronic pain, breakthrough pain breaks through the pain relief you get from your regular pain treatments. Breakthrough pain is not always controlled by the regular doses of pain medication, for example, or other treatment. It usually comes on very quickly. It lasts as long as an hour, and it feels much like chronic pain, except that it's worse in terms of its severity or intensity. It can happen sometimes, or it could happen many times a day. And the treatments that are given for acute, chronic, and breakthrough pain can be different. One treatment does not address all kinds of pain. So from my perspective, I think the primary goals of pain management are relatively straightforward. What do we need to do to help somebody with their pain? We need to identify the problems caused by that pain, especially if you know specifically why you're having that pain, whether it is from treatment or a procedure, or it has to do with the kind of cancer that you have. Not only identifying the specific kind of pain that you have and where it comes from, but also identifying the problems that are caused by that cancer pain. Another goal is to help you identify, express, and manage your emotions around pain. Again, a reciprocal process. Pain can sometimes really get us down. How do we deal with that particular emotional response, for example? A good pain management plan works with your mind and body and your pain responses. A good pain management plan doesn't focus just on the physical nature of pain. A good pain management plan helps you organize your life to keep pain managed as much as possible. It is designed to help you maintain an optimistic perspective as much as possible. And it is designed to help you engage in and maintain meaningful relationships even while you are dealing with pain, so that you don't end up feeling isolated or disconnected from the people around you. And for healthcare providers, a psychosocial pain assessment is just the process of determining and understanding the context in which your pain is occurring. What happens when you feel pain? How do you feel emotionally, physically, socially, spiritually when you have pain? It is usually done by self-report, and it can also be done by observations by family members, loved ones, caregivers, or healthcare professionals. But how do we determine a level of pain if pain can't be seen unless there is a specific injury? If pain can't be seen on an x-ray or a blood test, or a specific test that can be done that says, yes, you have pain, yes, this is the kind of pain that you have. So there are a number of pain scales out there that most healthcare providers use. The numeric pain intensity scale is the most widely used pain scale in the world, and it has been translated into, I believe, 34 or 35 different languages. It's probably the one that people recognize the most, the 0 to 10 scale, 0 meaning no pain, and 10 meaning the worst possible pain. And look who created it, Margot McCaffrey, the pain management nurse who created the subjective definition of pain. She developed this numeric pain intensity scale in 1999, and it is, again, the most widely used pain scale in healthcare. And there is a different one called the Wong-Baker-Faces pain scale, also 0 to 10, has some words, 0 meaning no hurt, 10 meaning hurts worse, but it also has some faces that are meant to represent the person's internal experience of pain. So if somebody doesn't have the words to be able to describe their pain, or if they have cognitive limitations, or children don't really know how to talk about pain, they can point to the face that best represents their internal experience. And there are a number of these that have been developed. There is even a Lego pain rating scale for children. And I will come back to this again, because sometimes, especially if somebody is having a lot of pain daily, every few days, weekly, etc., it's really hard to remember the actual experience of pain unless you keep track of it. And so I often recommend that people use a pain notebook, a pain diary, a pain journal, something that will help them be able to remember. If you went to your doctor tomorrow and your doctor said to you, okay, well, let's track your pain over the last week or two. How are you feeling? What was your pain level 2 weeks ago? You might not be able to remember, but using something objective like a pain notebook or pain sheets, you can keep track of your pain in as much detail as you would like. This particular one on the left is an hourly log, and then on the right, there is a daily pain summary, information about what medications or treatments you were taking, how helpful were those treatments to you at that time. There is, on the bottom right-hand side, there is a human figure. People can mark the location where they're feeling their pain. And these tools are often very useful. If you keep track of your pain, you can often go in and show your doctor or nurse, who can look at them very quickly and get a sense of how your pain has been over the course of a period of time, let's say a week. Is it worse than it was a week ago? What was it like 2 weeks ago? Is the pain treatment plan working? Should we keep doing what we're doing now because it's helpful, or should we revisit and reassess to find something that would be more effective? It's a really, really good way of being able to keep track without having to remember, especially when pain is intense. And it's a really good tool to be able to share with your healthcare team so that they could get a sense of your pain experience as well. And there are a number of these available at no charge on the internet. I have a resource for you at the end of the presentation. So how do we treat pain? There are a wide variety of treatments for pain. Most people think of medication options. That's probably the thing that most people think about, is taking medication, a non-opioid or an opioid strong medication, also called pharmacotherapy. But there are also physical medicine and rehabilitation approaches, injection and infusion therapies, implantable devices and surgical interventions, and mind-body interventions. Even beyond medicine, there are some evidence-based practices that help people be able to manage their pain more effectively. Briefly, lots of different non-opioid options: over-the-counter aspirin, acetaminophen, ibuprofen, non-steroidal anti-inflammatory medications, There are also topical gels and ointments that are available, some with a prescription, some without a prescription, and local anesthetics. The wide range of opioids that are available, you have heard of many of these. These are the generic names: morphine, methadone, oxycodone, fentanyl, for example. The benefit of these is that they can be given in many different ways, not just taking a pill by mouth, but it can be given as a rectal suppository, an intravenous injection, under the skin in the form of a patch like fentanyl, or as an infusion, which I'm going to talk about a little later. Just remember, and you probably already know, that opioids are very strong medications and they need to be managed well in order to avoid distressing side effects, in order to avoid running into trouble. They are very, very strong medications, but they have a place in the pain management world. Many people benefit a great deal from opioid medication. And then there are what is called adjuvant analgesics. Adjuvant analgesics is a loose term referring to medications that were originally developed and used for conditions other than pain, but that are used now in pain management to help relieve specific pain problems, such as antidepressants or anti-seizure medications are often used to treat neuropathic nerve pain. You might say, or you might hear somebody else say, well, I don't think I'm depressed, or I've never had a seizure. Why am I being prescribed this particular medication? It's because even though they were developed for other conditions, they have been found to have important pain relieving properties. And so they are increasingly being used in the overall management of pain. Steroid medications, also often used for pain caused by inflammation, and muscle relaxants, anti-insomnia, and anti-anxiety medications also used in the overall management of pain. Regarding medical marijuana, as of today, 30 states and the District of Columbia have passed medical marijuana laws. Medical marijuana has long been used for pain relief, control of nausea and vomiting, appetite stimulation, and more. One of the benefits is that it's available in many forms. It's kind of complicated to think about smokable medical marijuana, which may increase the risk of smoking-related disorders, but medical marijuana can be gotten in different forms: topical creams, oils, rectal suppositories, mouth spray, and solid and liquid edibles as well. But be very careful, right? 30 states have made it medical marijuana legal. It is still a federal offense. The legal and practical issues surrounding the use of medical marijuana are complicated and confusing. It might be very beneficial to read the updates and view the medical marijuana update on the Triage Cancer site, because they have very, very good information about medical marijuana for cancer, the use of medical marijuana by cancer patients. And for those cancer patients who are able to benefit from physical medicine and rehabilitation, physiatry is a very good option. Physical therapy, occupational therapy are probably the physical medicine and rehabilitation approaches that most people know about. There is always also exercise physiology, hydrotherapy, water therapy, heat and cold therapy, and transcutaneous electrical nerve stimulation, also a very well-known approach. The TENS unit, now available over the counter for people who want to be able to use a nerve stimulation unit to help them manage their pain. Injection therapies are procedures that involve placing a needle into, for example, a joint, muscle, spine, around a specific group of nerves, and the injection of something, medication or some kind of treatment, electricity, heat or cold. For example, nerve blocks and botulinum toxin injections. Yes, botulinum toxin is Botox. It is used for cosmetic purposes. It is also used very effectively in pain management as well. What does it do? It paralyzes the nerves that are sending signals to the brain. Infusion therapy is very similar. It involves giving medication through a needle or a catheter, usually prescribed when a patient's condition, their pain is so severe that it can't be treated very well with oral medications. The most well-known infusion therapy delivery is the PCA pump, patient-controlled analgesic pump. But it can also be intraspinal drug delivery, drugs that are injected through a needle or a catheter directly into the spine. And then implantable, implants and surgical interventions, a spinal cord stimulator or an intraspinal drug delivery system, which crosses a couple of different categories. Every single treatment approach that I have just talked about is designed simply to interrupt the signals from going from the site of the injury through the central nervous system and registered by the brain. They just do it in different ways, but every single treatment is designed to interrupt those signals so that they are not perceived, those pain signals are not perceived by the brain. And there are non-medical approaches that have been found to be very, very useful for people experiencing chronic or cancer pain. Mindfulness, for example, living in the here and now, focusing on the here and now, meditation, guided imagery, relaxation exercises or breathing exercises, prayer, biofeedback, yoga. Many people find some of these approaches to be very helpful, just helping them with their pain and also helping them with their coping, increasing their coping as well. And then there are body-based methods, acupuncture, acupressure, chiropractic care, massage therapy for people who are able to benefit from these. And not everybody can, because sometimes, for example, something like massage therapy might hurt or yoga might hurt, right? So not everybody can use all of these methods, but for those who can, they might want to think about body-based methods to be able to help them in the overall management of their pain. Many of you may have heard, I hope no one has said this to you directly, but you may have heard out there in the universe, people believing that pain is all in your head, right? But I just want to reiterate that chronic pain is real. You are not crazy for having pain. You are not making it up. But in a way, it is all in your head, because the brain is the master organ that processes pain signals from the body, right? It processes pain signals as sensations, emotions, and thoughts, not just sensations. All pain is regulated by the brain. Emotions, like pain, are creations of the physical brain, right? It's a complex interaction of electrical and chemical impulses in the brain. But having pain, in addition to that sensory experience, is also a strong emotional experience. So we think about the kinds of approaches beyond traditional medical care that will be helpful to people with pain. And these are things that you might want to consider to help you with your pain. Cognitive behavioral therapy is a treatment approach, a psychological treatment approach that has been found to be extremely helpful for people with long-time pain. What does it do? It challenges the thoughts and misconceptions about pain. It recognizes the relationship between emotions that are felt and pain. And it helps the client shift from helplessness to feelings of control. It promotes improved functioning and improved quality of life. Psychologists and social workers are excellent people to be able to provide cognitive behavioral therapy and some of these other approaches. Eye movement desensitization and reprocessing, known as EMDR. It really targets sensory distress, the distress in the body. In the absence of a traumatic memory, it focuses on the distress that a person feels in their body. EMDR was developed for people with post-traumatic stress disorder, but other people have been working on providing EMDR and studying EMDR treatment for people with chronic pain, and there are specific EMDR protocols for people with chronic pain. EMDR has an increasing body of research that shows a significant reduction in both the physical aspect of pain and the emotional distress associated with that pain. And these particular interventions require a trained professional. Not every psychologist or social worker or even psychiatrist can offer them. This is additional training that those healthcare providers will get in order to be able to provide these treatments for people with pain. Hypnotherapy, also found to be very, very helpful for pain. It teaches enhanced concentration and distraction, heightened responsiveness to suggestions to change or alter your thoughts, feelings, behavior, or your physiological state. None of these make you forget that you have pain. What it does is help you respond to that distress in a different way, so that you're not feeling overwhelmed, you're not feeling helpless. These are things that you can learn from a provider and then be able to implement yourself. Psychoeducation is also really important. When I first started working in the chronic pain world, a lot of people would contact my agency because they were just diagnosed with a pain condition and they didn't know anything about pain. It's not something we like to talk about. It's not something we talk about a lot in very positive ways, but psychoeducation can offer both education and psychological support to individuals and their families, and people with pain and their families, to help empower them and deal with pain in a more optimal way, to increase coping around pain. And again, because pain has a social component to it, family therapy and education can be helpful too. When somebody has pain, their family is also affected in a psychological and a social way. Family therapy might help identify the impact on family members, support family members, and encourage communication so that the patient and the family members are not sort of living in isolation and avoiding the topic of pain. Support groups, pain-focused support groups or group therapy are helpful in reducing isolation, in normalizing the experience of pain. It helps people learn healthy coping from other people who share their experiences, what helps and what doesn't help. And it provides group members who model stages of change in healthy behaviors. In any group, there are people at different stages of their pain experience who all learn from each other. I will say, though, that it might be a little bit more difficult to find in-person support groups, pain-related support groups. They're also hard to keep going because people might not feel well the one time in the month or in the week that the group is meeting. And so there are a lot of support groups for people with pain and for family members of people with pain on the internet. Many organizations, pain-related organizations, have online support that is available to anybody who wants to participate. I just want to sort of underscore the idea that as a person with cancer pain, you absolutely have the right to have your report of pain taken seriously, to be treated with dignity and respect by doctors, nurses, pharmacists, social workers, and other healthcare professionals. You also have the right to participate actively in making decisions about how to manage your pain. Pain treatment doesn't just happen to you. You are an active member of the pain care team. And you might want to think about some questions that will help you assess your involvement in your treatment plan and to assess the healthcare providers who are also helping you with your your treatment plan. And so these are questions that I, just put together to help you think about how you want your relationship to be with the people who are helping you with your pain management. Are you and your provider willing to work together to build an effective and workable pain management plan? Pain assessment doesn't happen just once, and then you're sent off to deal with your pain over a long period of time. Pain assessment is an ongoing process that involves input from both the provider and from you as well. Does your provider expect you and respect you, expect you to be a key member of your pain care team and respect you as a key member of your pain care team? Does your provider listen to your pain reports, ask questions? Does your provider listen carefully to your response and concerns? And one of the things that I often talk about is that language is really, really important. People do not complain about their pain. Complaint has a very distinct meaning in the world we live in. We shouldn't call them complaints of pain. We should call them reports of pain. Does your provider take the time to explain each treatment to you? Whether it's a treatment that you are considering or the treatment that you are undergoing. Are both the risks and the benefits of those treatments explained to you satisfactorily? In this very busy healthcare practice world, providers unfortunately, don't have a lot of time to sit and spend with their patients. So if you have pain to report, if you are experiencing pain, I really encourage you to make that the priority for an office visit. Don't wait, don't put it on the list as the fourth, fifth, or sixth item that you're going to talk with your healthcare provider about, because you may run out of time. Pain is important, and managing pain is really important. That should be, if you are experiencing pain, that should be a priority for discussion with your healthcare provider. Does your provider encourage you to ask questions? And do they answer them in a thoughtful manner, in a way that you are able to understand? Do you feel comfortable asking for more explanation or telling your provider you don't really understand what they mean or what they're talking about? Do you ask questions? And I hope you do, and provide answers to the provider's questions in a thoughtful manner as well. That's part of strengthening your relationship with your healthcare providers. Do you report accurately and truthfully about your pain and the effects of the treatment plan? It's not helpful, as we know. We never like to be weak. We never like to be perceived as not doing well. When people ask us how we're doing, it's human nature to say, I'm okay, I feel fine. But if you have pain, you have to report accurately so that people know, especially your providers know, that you're experiencing pain, how you are experiencing pain, and what you can all work on together in order to relieve it as much as possible. Do you use a pain journal or notebook or something to track your pain and show how your pain affects your daily living? Not just the pain itself, the location and the intensity, but how pain affects other aspects of your life. Are you willing to explore different treatments? and medications that are available. I often encourage people to think about a broad treatment plan that involves multiple approaches. If medication is one option, there might be an option for physical medicine, or there are definitely options for mind-body medicine, or some different approaches. Medication, physical medicine, meditation, hypnotherapy, for example. It doesn't have to be one treatment. It could be a number of things that are helpful to you. I encourage you to talk about all of those things with your provider so that they know the kinds of things that you are doing to participate in managing your pain. Whatever the treatment plan is that is developed for you, are you comfortable sharing the results? Sharing the results of that treatment or those treatments, for example. Is it working? We always want to hear that things are working, but it's also important to share information if the pain treatment plan is not working. There's no reason why you have to suffer in silence. You can and should share that information with your pain management providers. And is your provider open to receiving and discussing those findings, even when they're not so positive? Again, it's very, very important for providers to know if something is not working. Does your provider help you set realistic goals? Right? Things that you want to achieve with your pain treatment. For some people, I think for a lot of people, especially with regard to cancer pain, a goal of a 0 on a 0 to 10 pain scale might not be realistic. What is your goal? What is appropriate for you? What is acceptable for you in terms of pain reduction? And how can both of you, not just you, but both of you, your provider and you, working hard to reach those goals? Because even though pain may not be reduced to a 0 or eliminated completely, there's always something. I firmly believe that there's always something else that can be done to help manage pain and to improve your quality of life. It's not just about the pain, it is about your whole life and what is important to you and what is meaningful for you. I want to leave you with a couple of resources. Certainly, Triage Cancer provides a wealth of resources on their website. Feel free to come back and visit as often as possible, download or save or print as you wish the information that is available. And don't forget to take a look at some of the other webinars on topics that are of interest to you. I want to talk a little bit about the pain community. As Sarah mentioned at the beginning of the webinar, I am a founding board member of the pain community. There are a number of us. Some of us are healthcare professionals. Some of us are people with pain or caregivers to people with pain who created a national nonprofit community called the Pain Community. And we offer information about pain, information about advocacy, both personal advocacy as well as sort of, legislative media advocacy. And the pain community also offers chats and discussion boards. The discussion boards are open 24/7. There are 3 designated chats during the week, but the chats are open. There might not be somebody there to talk with. And we also offer a weekly telephone support call for anyone around the country who just wants to connect with somebody else who has pain. All of our groups are moderated. All of the people who are volunteer moderators are people who have experienced pain themselves or are caregivers to people with pain. And like with Triage Cancer, all of the services are available at no charge. The American Cancer Society has a tremendous number of resources on their website. They also have a daily pain diary that you can download, the worksheet that you can download from their website, and the link is there. And they also have an excellent booklet about cancer pain, treatments and side effects, how to be able to deal with pain, how to communicate about pain, things that you need to know about cancer pain. Excellent, excellent resource. And because we're in the modern world now, there are smartphone apps that are available. These are 3 that are available for free. There are others that have a nominal charge, in which you can track your pain on your smartphone. These are available for both iPhone and Android phones. You can keep track of your pain. You might be able to print some out. The more sophisticated ones also give an option of sending your report as an email to a designated healthcare provider. So, for example, you can print it yourself and bring it to your next appointment when you're going to talk about pain, or if the doctor has this, or the social worker or the nurse has this available, you can have the app send your report over a period of time to maximize the time that you spend with your treatment provider. I hope that this gives you some things to think about with regard to managing your pain more effectively, thinking about the ways that you can communicate with your healthcare team in a way that is helpful to you, and be able to think about the broad range of treatment options that are available that can help you with your pain. It would be a wonderful thing if we just had a magic bullet, one thing that we could give to people experiencing pain that would take their pain away. And unfortunately, pain is so much more complicated than that, that it's important for us to be open to the different ways that make sense to each of us to be able to manage pain more effectively, increase quality of life, strengthen the relationships with the people around us who are also affected by pain, and be able to live as meaningful and as important a life as we are able to, even in the face of pain. So I want to thank everybody who is on the call. I want to thank you all for your interest, your time, and attention. And I hope that this has been helpful to you and given you some things to think about that will help you manage your pain more effectively. Thank you.
Thank you so much, Dr. Colón. We do have a few moments for some questions, and I did receive one that I wanted to put out here. Somebody mentioned that laughter therapy is used by the Cancer Treatment Centers of America and other places as a body-based method. And could you speak to that?
Sure. Well, I mean, there's a lot of research and a lot of anecdotal information about the idea. Not only does laughter make us feel good, but it releases endorphins in our body that help us feel good. That, I would say, is what, even though I didn't list that on, it's hard to list the numerous approaches that people can take. But that's another way that people can take, sort of responsibility in a way of doing something. It's something that's easy to do, doing something that will enhance their coping, enhance their distraction from the pain, increase their resilience. And that's one way that people can individually, it doesn't cost anything, right? You could do it at home on your own. Something that people can do that will affect their experience of pain.
Great. Okay. I think we're going to have to wrap up with that because we are at 1 o'clock already. So thank you to everyone. We hope that you have found today's presentation useful and will continue to stay connected with Triage Cancer. And just one more slide to remind you about contact hours. As a reminder, in order to receive credit, you must have registered online for today's session. People who are listening in on someone else's computer will not be eligible for credit. You must also have attended the entire webinar. No partial credit will be awarded. Anyone watching a recording of this webinar will also not be eligible for credit. Within 1 week of this webinar, you must complete the evaluation and receive a passing grade. You will receive an email following this webinar that will contain the link to the evaluation and post-test. And please remember that the evaluation asks for your name and email address. You must include these so that we can certify that you completed the evaluation. That email address is where we will mail your certificate. We'll be sending out certificates within 4 to 6 weeks. And again, we are only offering contact hours to nurses at this point. If you have any questions or experience any problems, please email us at info@triagecancer.org. This concludes today's webinar. Thank you all for joining us. Goodbye.